Could someone you love be showing early signs of dementia, right now, and you just haven't noticed? On Wellness 60 to 100, your trusted guide for healthy aging, we reveal the subtle red flags families often miss. These small changes may seem harmless, until it's too late to act. Carol, a 74-year-old retired teacher from Michigan, had always been sharp, warm, and organized. She loved crossword puzzles, hosted Sunday dinners, and never missed a birthday. But over the past year, her daughter noticed subtle changes. Carol would repeat the same story twice in one conversation. She stopped cooking her favorite recipes and seemed indifferent when friends canceled plans. The family chalked it up to normal aging. "She's just getting older," they said. Then one afternoon, Carol went grocery shopping and didn't come home. She was found hours later, disoriented in a parking lot several miles away. A neurological evaluation confirmed early-stage dementia. The clues had been there, but they were easy to overlook, until a crisis made them undeniable. Carol's story isn't unique. Many families miss the early signs because they expect dementia to start with obvious memory loss. But in reality, it often begins with subtle shifts in behavior, motivation, or personality. If caught early, there are treatments and lifestyle strategies that can slow cognitive decline and improve quality of life. But first, you have to notice. And more importantly, you have to believe what you see. I'm Dr. Emily Carter, a board-certified geriatrician. Dementia doesn't always start with forgetfulness. The first signs are often emotional or behavioral, like withdrawal, apathy, or subtle confusion. Families often miss them, thinking it's just aging or stress. In this video, I'll help you recognize the early warning signs before the window for early intervention closes. Dementia doesn't appear overnight, and the earliest signs are rarely dramatic. On Wellness 60 to 100, your trusted source for healthy aging, we explore how subtle changes in mood, motivation, or behavior may be the very first signs of cognitive decline. Many families overlook these red flags, believing it's just normal aging, until a loved one becomes lost, confused, or withdrawn. But early detection can make a powerful difference, giving families time to plan, seek treatment, and help preserve independence longer. In this episode, we'll break down the signs most people miss and show you how to recognize them before dementia takes hold. Because when it comes to brain health, timing is everything. When most people think of dementia, they picture memory loss, forgotten names, missed appointments, or repeating questions. But the first signs of dementia are often not about memory at all. They're changes in behavior, emotion, and daily habits, subtle enough to miss, yet significant enough to matter. One of the earliest and most common symptoms is apathy. Your loved one may lose interest in hobbies, social events, or even conversation. They might stop reading the newspaper, abandon favorite pastimes, or seem checked out during family gatherings. This isn't laziness, it's a shift in brain function. Another red flag is a change in judgment or decision-making. Perhaps a parent who was once cautious with money begins spending impulsively, or someone forgets how to cook a basic meal they've made for years. These changes often emerge gradually, so they're easy to excuse or rationalize. Mood changes are also early indicators. Irritability, anxiety, or unexplained sadness can surface before any memory loss. Some people grow paranoid or suspicious, accusing others of stealing or hiding things when they've simply forgotten where they placed them. You might also notice changes in routine or hygiene, piles of unopened mail, dishes left unwashed, or clothes worn repeatedly. While we all have off days, a consistent pattern of disorganization or neglect may be your clue. Unfortunately, these signs are often mistaken for stress, depression, or just slowing down. But when they cluster together, especially in someone over 60, they deserve attention. Early behavioral changes are like whispers from the brain that something is wrong. If you hear them, don't ignore them. The earlier dementia is identified, the more tools and time you have to slow its progression. Dementia doesn't just affect memory, it often begins by reshaping a person's emotional world and social instincts. In fact, some of the earliest signs appear not in what someone forgets, but in how they feel, react, or engage with others. One of the first clues may be withdrawal from social interaction. A once talkative, lively individual may begin skipping family events, avoiding phone calls, or sitting silently in group settings. Families often attribute this to burnout, just being tired, or wanting quiet time, but withdrawal can be an early indicator of cognitive changes. The brain may be struggling to keep up with conversations, recognize faces, or follow group dynamics, causing the person to retreat. Another subtle warning is a shift in empathy. A person may become less emotionally responsive, fail to show concern when someone is upset, or respond inappropriately to emotional situations. They might laugh at something sad or react blankly to joyful news. These are signs that dementia may be impacting the brain's emotional regulation centers. Irritability and sudden mood swings are also red flags. Your loved one may become angry, frustrated, or overly sensitive in situations where they previously remained calm. They might overreact to minor stressors or lash out unexpectedly. Additionally, watch for signs of increased anxiety, paranoia, or depression. Some people with early dementia develop fearfulness, worrying about being alone, misplacing items and thinking they've been stolen, or expressing a vague sense that something's wrong. These emotional shifts are often misunderstood as mental health issues, but they could stem from a deeper neurological cause. These changes don't mean someone is going crazy. They mean the brain is trying to communicate. And recognizing these emotional and social signals, instead of brushing them off, can be the first step toward getting help. It's perfectly normal to become a little forgetful with age. Everyone misplaces their keys or forgets a name occasionally. But how do you tell the difference between normal aging and the beginnings of cognitive decline? The distinction lies in patterns, frequency, and impact on daily life. For example, with normal aging, you might forget someone's name but remember it later. You may take longer to learn new technology, but you eventually get the hang of it. You occasionally lose your train of thought, but you can regroup and continue. You misplace items but find them after retracing your steps. With cognitive decline, the issues become more persistent and disruptive. You forget names and never recall them, even with cues. You ask the same questions repeatedly without realizing it. You struggle to follow simple steps, like making coffee or paying bills. You put things in illogical places, like the remote in the refrigerator. You get lost in familiar places or feel confused about the day or time. Another key difference is awareness. People experiencing normal age-related forgetfulness are usually aware of it, and even joke about it. Those with early dementia often don't realize they're forgetting or become defensive when it's mentioned. You should also watch for changes in language, such as trouble finding common words, using vague substitutes, that thing, or struggling to follow or join conversations. These are often signs of deeper processing difficulties in the brain. The line between aging and dementia can be subtle, but it matters. Catching cognitive decline early means more options for treatment, planning, and maintaining quality of life. If you're unsure, trust your instincts and seek professional evaluation. Clarity now can protect independence later. Noticing signs of early dementia in someone you love can be unsettling, and starting the conversation may feel even harder. Many families delay saying anything, afraid of hurting feelings or sparking denial. But silence allows the problem to grow. The key is to speak early, gently, and with compassion. Start by choosing the right moment, a quiet time when you're alone and not rushed. Avoid bringing it up in public or during stressful events. You might begin with something simple and non-threatening, like, "I've noticed a few changes lately and wanted to check in. How have you been feeling?" Use I statements instead of you accusations. Say, "I'm a little concerned because I noticed you've been forgetting a few things," rather than, "You keep forgetting everything." Focus on your concern and love, not blame. Emphasize that you're on their team. "I want us to catch anything early, just in case. It could be something small, but I think it's worth checking out." Expect mixed reactions. Some people may feel embarrassed, defensive, or even angry. That's okay. Don't push. Leave space for processing, and revisit the conversation when things feel calmer. If they agree to see a doctor, offer to help schedule the appointment, or go with them. Having someone by their side can ease fear and show that they're not alone. If they resist, don't give up. Keep a log of behaviors, talk to their primary care physician privately, or seek advice from a memory clinic or social worker. Most importantly, remember, early action isn't about labeling someone, it's about protecting them. Talking about dementia doesn't take away independence, it helps preserve it longer. When you suspect a loved one is showing signs of early dementia, knowing what to do next is critical. Early intervention can slow cognitive decline, provide access to better treatment options, and help preserve quality of life for years. The first step is to schedule a visit with a primary care physician. Come prepared with specific examples of behaviors you've noticed, missed appointments, repeated questions, confusion in familiar places, or mood changes. This helps the doctor take your concerns seriously. From there, the physician may order or refer for the following tests. 1. Cognitive screening tests. These include the Mini Mental State Examination, MMSC, or the Montreal Cognitive Assessment, MoCA, which assess memory, attention, language, and problem-solving skills. 2. Blood tests. These check for conditions that may mimic dementia, like thyroid problems, vitamin B12 deficiency, or infections. 3. Brain imaging, MRI or CT scan. These help detect brain shrinkage, strokes, or tumors that may explain changes in behavior or thinking. 4. Depression and mental health screening. Since depression can cause memory issues in older adults, it's important to rule out treatable mood disorders. 5. Neurology referral. If early cognitive decline is suspected, a neurologist can perform deeper evaluations, including more advanced memory and function tests. Once a diagnosis is made or ruled out, early intervention may include medications that help slow symptoms in Alzheimer's and some other dementias, lifestyle adjustments, like memory aids, routine building, and home safety changes, caregiver planning, legal preparation, and emotional support resources. The sooner these steps are taken, the more empowered your loved one remains in their care. Remember, early diagnosis doesn't mean the end, it means a new beginning with more control, clarity, and compassion. Take the first step now. When early dementia signs are overlooked, the consequences can be heartbreaking. What begins as mild confusion or social withdrawal may quickly escalate into wandering, unsafe behavior, or loss of independence. Without early intervention, families miss the chance to plan ahead, explore treatment options, and support their loved one through the most manageable stage of the disease. By the time dementia becomes obvious, it's often progressed beyond the point where meaningful support or cognitive therapies are most effective. Delaying action doesn't protect your loved one, it leaves them more vulnerable. Catching dementia early can preserve years of clarity, safety, and dignity, for both them and you. As a geriatric physician, I can't stress this enough: don't wait for memory loss to act. Dementia often begins with subtle changes in behavior, social engagement, or mood, signs that families easily dismiss. If you notice repeated questions, growing apathy, or personality shifts, it's time to speak up. Start by gently encouraging a medical evaluation. A basic cognitive screening, blood work, and brain imaging can reveal a lot, sometimes even reversible causes of memory loss. If dementia is diagnosed early, we can explore treatment options, plan care, and help maintain independence longer. Also, don't ignore your instincts. Families often sense something's off before doctors do. Write things down, advocate for testing, and don't be afraid to ask hard questions. Early diagnosis won't fix everything, but it gives your loved one a voice in their future, and that is a powerful gift. Dr. Emily Carter. If this video opened your eyes to the early signs of dementia, don't keep it to yourself. Like, comment, and share to help other families take action before it's too late. And be sure to subscribe to Wellness 60 to 100 for trusted guidance on healthy aging. Hit the bell, you might protect someone's future, starting today.